Good morning, everyone. Can you hear me? And if you can, would someone just put in the chat that you can hear us clearly? Great. Thank you, Jessica. I appreciate that. Thank you so very much. Today we have a wonderful program entitled The Impact of Mental Illness on Parenting Capacity in a Child Custody Matter. Our speaker today is Dr. Joseph Pasley, and I'm going to talk about him in just a moment. I just want to first thank you all for attending. This is going to be a tremendous program. Dr. Pasley is just we're so grateful to have him accept this invitation to speak with us. For those of you on the call, I want to do a little bit of housekeeping rules and things of that nature before we get started. This program is a 2-hour program. And as a result, what we're going to do is Dr. Pasley is going to begin the program, and within an hour or so, we will break for about 5 minutes. At that time, you can all, get a cup of coffee or whatever it needs to do, and then we'll resume for the second hour. I also want to let you know that as you come up in your minds with questions or thoughts or comments that you think would be helpful to the rest of the team, please feel free to put them in the chat. I will stop periodically. I'll be monitoring the chat, and periodically we will entertain the questions as they come up in the chat. I know there are some of you online that have heard me talk about MVLS before, but there are some of you that are new to this to our program, especially those who have just been involved in our new family law cohort. I just want to go over briefly what we're about. MVLS is a organization, the largest one in the state of Maryland, pro bono organization in the state of Maryland, that provides pro bono representation to those underserved litigants, clients, potential clients in Maryland who would otherwise not be able to afford or access legal services. And we do this to promote equality, to make sure that our laws are fair, and to engage in community practices so that we all work together for this common goal. MVLS is an organization that represents clients in civil matters only. This particular program is being sponsored by the Judicare program. We also are involved in cases where clients have issues with housing, tax controversy, expungement cases, housing, I think I just mentioned, consumer issues, and family law issues, as well as estate and guardianship issues. The Judicare program is one that is very near and dear to my heart. I've been a family law attorney for many years and also a healthcare attorney. I was a former registered nurse prior to becoming an attorney. And I will tell you that family law is an all-encompassing area of the law. We touch on everything. I've heard people say that family law is easy. It's not easy. It's probably one of the most difficult areas of law that is out there that we happen to practice in. The Judicare program itself is a program that assigns to our volunteer attorneys complicated custody and divorce cases. And those cases are compensated for at a rate of $4,200 per case. That is paid to the attorney who takes the case. There is a requirement that those individuals who are involved in the Judicare program have at least 3 years experience with representing these types of cases, or at least 2 years experience being mentored by an experienced family law or Judicare attorney. And I tell you this because for those of you who are interested in building your practice, you will have that opportunity to be a part of our Judicare program in time. Most of you on this call are members already of the Judicare program, and we thank you for that. I do want to say one thing before we start. This program is not intended to make you feel as though you are the diagnostician or the treatment individual in these cases. This program, we are not physicians, we are not psychologists, we are not social workers. We are attorneys, and what this program is guiding us to is how to handle cases where we think there might be a mental health issue or a substance abuse issue or something that is impacting and impairing the mind of our clients and their ability to defend their case or to be a part of their case. And Dr. Passley has agreed today to help us with that, to guide us through what we should recognize when we need to reach out to a professional in this field, what documents can be or cannot be admitted as evidence, and various other things about what a case like this might look like. So I want to make sure you all are aware of that. Let me tell you a little bit about my friend and speaker, Dr. Passley. Dr. Joseph Passley is a licensed psychotherapist, consultant, educator, and author and owner of Passley Consulting and Psychological Services. He holds degrees in clinical psychology, his PhD, an MA in counseling psychology, a BS in counseling, and an AS in Bible. Prior to starting his practice, he served in a group practice as a behavioral health specialist, providing high-quality outpatient mental health treatment for children, adolescents, and adults. His professional background is also attributed to his experience in providing behavioral health services to children and adolescents in inpatient, partial hospitalization, and respite programs. He has provided services to children, adolescents, adults, individuals, couples, and families in therapy settings and outpatient mental health treatment centers and programs at the Johns Hopkins Bayview Medical Center and Shepherd and Enoch Pratt Psychiatric Hospital. He has conducted professional and academic presentations both nationally and internationally. Among these included lecturing and leading roundtable discussions for other professionals from around the world, sponsored by the University of Oxford's Roundtable in Oxford, England. He has contributed to significant topics affecting the community, speaking to various media outlets, including but not limited to children and holiday depression, parental absence and its impact on society, and young children and aggression in the classroom. Dr. Passley is an author of Single Parenting in the 21st Century and Beyond, and also From Depression to Aggression, where he shares his knowledge and offers insight into many of society's greatest and most significant problems. His biography is included in highly esteemed references, including Who's Who in the World, Who's Who in Medicine and Healthcare, Great Minds of the 21st Century, Leading Health Professionals of the World, and Leading Educators of the World. And with that, I need say no more. Welcome, Dr. Passley. Thank you, thank you, thank you for being a part of this very important discussion. I will turn the tables over to you. Again, we are so very grateful. Thank you.
Thank you. Thank you, everyone, for participating today. Thank you for the kind introduction, Nancy. It's great to be here today and to disseminate as much knowledge as I can on this important matter. As we all know, mental health has been on the rise. Some statistics that I can say starting off is that 1 in 5 individuals will have a mental health disorder. About 20% of people in the U.S. will meet the criteria for a substance use disorder. And out of all of the disease states, major depressive disorder ranks number 1. And lastly, suicide actually is the 10th leading cause of death in the U.S. So we're going to get into mental illness and the effects of divorce on children, looking at parenting capacity, and also as an attorney, what are some things to really look at? Because I've worked with attorneys throughout the years, and we collaborate because I need no information from the attorney, they need no information from me, but it's always good to collaborate with professionals, especially when we look at child custody. So I'll begin now. And as I talk, as Nancy mentioned, if you have any questions, just write them down, and Nancy will, interject at some point so I can answer the questions. So we have just an agenda for today that I'm going to try my best to get through, understanding the effects of divorce on children, identifying parenting and co-parenting tasks and behaviors that may be affected by mental illness and substance abuse, identifying parental capacities that are linked to child outcomes, and understanding how to effectively integrate behavioral health information into matters of custody. And then lastly, presenting attorney considerations when representing clients with mental illness and substance abuse. All right, so first we'll look at the effects of divorce on children. So it's something that I've seen many, many times in my practice over the years, starting off with Sheppard Pratt, going into Hopkins, and then starting my own practice for many years, just looking at the effects of divorce. I mean, divorces are very common today, but one of the things I always hear from parents is that, well, my children will be okay. And we'll get into that today during the presentation of how they're not okay, because it really has a profound impact and effect on the children. I just want to start off with this is very common, a theme that I hear from many children, adolescents, and even adults when we go back and explore childhood experiences, childhood trauma. But I'll just go through it very briefly. I remember hearing my parents screaming and arguing a lot at night. My father kept yelling, "This is it, this is it, and I can't deal with this anymore." Hearing that often from my dad worried my sister and I. My anxiety was at an all-time high as the arguing continued. The day came, unfortunately, when my parents both sat us down and discussed that they were separating and subsequently divorcing. I don't think I heard anything after the word divorce. So it's a real shock, for kids when this takes place, as far as the finality, because they sort of figure something is out, like the anxiety starts to skyrocket. They think, well, mom and dad are arguing. Why does it continue to keep occurring? But when it actually happens, it disrupts the child's well-being. And I have a quote here from Judith Wallerstein. She does a lot of research on the divorce, and I thought it was a good quote to include in the PowerPoint. But she said, "The devastation children feel at divorce or a separation is similar to the feeling when a parent dies unexpectedly. For each experience disrupts close family relationships. It weakens the protection of the family. Each begins with an acute crisis, followed by disequilibrium that may last several years or longer, and each introduces a chain of long-lasting changes that are not predictable at the outset." So that really encompasses what takes place, during that time. And I know as attorneys, you're in the midst of this challenge. Who is more suitable in terms of we're looking at, 50-50, because there's always some challenges where there's, called projecting. Many times they project on the attorney, they project on the behavioral health clinicians because it's still disruptive not only to the child, but also to the separating parents. And we'll get into that a little later. So some statistics briefly, 43% of all first marriages will end in divorce. The statistics actually, divorce used to be about 50%, but what's happening now, the new generation is because of what they saw in the older generation, they're not getting married as we once did because they feel that cohabitating is much better than getting divorced because of all what encompasses, getting married and divorce. And when you are married and you get divorced, the number increases actually for second and third marriages. It can be for second as high as 60%, and if you remarry again, it can be as high as 70%. Research indicates that 20% of marriages are likely to end in divorce within the 5 years. That's very recent, and couples who married before 25 are far more likely to get a divorce than those who marry after age 25. So normally one of the risk factors, and when I counsel couples and they mention that they wanted to get married right out of high school or right out of college, I often say that it might be best to just have a longer engagement. And one of the reasons why that I say that is because your brain actually doesn't develop fully until age 25. So it's important to delay it until really after the age 25 when your brain fully develops and you can make more rational decisions. And in the book, Collateral Damage, Dr. John Sherman reported that more than 50% of parents believe that they were responding well to their kids during the divorce. 72% of children said, however, that their parents did a poor job of responding to their needs, and 52% of children surveyed said that they were drawn into their parents' battle during divorce. That's one thing that I mentioned when parents are arguing and bickering. You don't want to have a child take sides, and many times I often hear a parent saying, well, I want Johnny and I, to go and do this, or, Johnny, you're going to live with me, because dad or mom, they have real problems. They're the ones that cause this divorce. And why that's important to not draw kids in, because what happens then, there's a term called triangulation, and that's where the sides take place, and then there's some angst with the child because they feel like they're also abandoning, the other parents, and that can cause some anxiety, that can cause some depression, and for older kids, they actually start many times to experience with substances to sort of heal and cope with the tumultuous situation that they're in. 80% of children admitted that they did not express themselves regarding the divorce. So they kept it inside, but what happens is that's when, and we'll get into that, behaviors tend to manifest, and parents often say, well, what's going on? And there's academic decline, they're having behavioral outbursts, they're irritated, they're not sleeping, and that is a result of, not getting the child, to me, into therapy, psychotherapy, but then also having, the parents talking to them. Because to me, it's real important when they're going to get the divorce that they talk beforehand, maybe 1 or 2 times, to look and agree at what is going to be said to sort of mitigate the impact that this divorce will have on the child. So 84% of parents surveyed said that the divorce had a negative impact, and 80% reported that a lasting negative impact occurred on their children. So it does. So a lot of parents are in denial at first, but they start to see what happens as time goes on because of what took place during the separation and divorce. So those are a few statistics that I just wanted to read to you and explain, how just detrimental divorce can be, and everyone is affected, both parents and also the child or children. So when we break it down as far as age group, during the time for children 18 months to 3, this is a major time in their development and a bonding time. During that, there's a term called attachment. And during that time, it can be a major disruption and difficult for them to accept. It's very, very difficult. And this time, particularly a toddler, they may cry more, they may actually regress as a result. So thumb sucking, there's bedwetting, which is called enuresis. There's a term called diurnal enuresis, which means bedwetting in the day, and then nocturnal enuresis is in the evening. There's another term too called encopresis, and that's where kids they tend to defecate actually because of this challenge, this parental divorce that they can not really accept at all. And then something else that happens too is they tend to have sleep disruptions also. So they want their parent in the room, because in the room there's a representation of safety that this parent's not going to leave me. And then something that I'm not very fond of, which is co-sleeping actually. Now at this point, I would say this could happen because it is disrupting one of your safety. But what happens, what I've seen over the years, is then it can become a habit. And why that can be a problem is that children who tend to take that role now of the other parent tend to become entitled and disrespectful because they feel now that they're a parent. There's sort of an enablement during that time. So for brief periods of time, sleeping alone because of something as traumatic as this is okay, but if it becomes something continuous, that can be a problem. I just was dealing with a case just a few months ago where this 11-year-old was probably one of the most entitled kids that I've seen in quite some time, but it was a terrible custody case which was taking place. And I did ask, I said, I know he's 11, and some people get very offended when you ask this with a parent, but I said, hey, I just wanted to ask you something. What are his sleeping arrangements? And she said, why are you asking that? She got very defensive. I said, I just wanted to know. I mean, during a divorce, sometimes it can be tough to sleep by themselves. He said, well, yeah, he sleeps with me. And I knew that was the answer, because I could tell just the way that he acted, that sort of entitlement, and wanting to have that security, but the entitlement started to actually emerge. And then finally, toilet training, at this age too is something that really there's a regression, that takes place during this time. So when we move on to 4 to 6, this is, a concept too that's very difficult for them to comprehend because of the uncertainty. So children at this age, they don't want their parents to separate. So a lot of times what they'll do is they'll start to internalize or externalize their anger. I was working with another case where the parents argued a lot. This was just recent, and I kept warning them that these arguments are going to create problems with your 5-year-old. And they said, no, he doesn't listen. I said, I'm going to tell you that these kids are very, very perceptive, and they can sense. And about 2 months later, they said, hey, you know what? He's having some real problems at school. He's having problems at his church. He's having problems in the community. He's very disrespectful. He's breaking things. And I said, well, when was the last time you argued? Is this something that has been ongoing? And they admitted, they said, wait, we've been arguing quite often. I said, well, here's what I want you to do. If you don't believe that this has affected him, I want you to ask him 2 questions, and do not deviate from what I'm going to ask you, because at that age, they're not good at expressing themselves. And they did ask the questions, and he came back and he said, "Yeah, I want you both to be together. I don't want you to leave at all." And they turned it around, and you know what happened? He's doing well in school. He's doing well at home. He's doing well at community, at church. So it just shows you again, just the impact that, a kid as young as 5 can really start to do things out of anger because of, what's going on at home. But also too, what happens is for young kids, they do that so that the attention can be brought to them. They want to do, and it worked, because they started now saying, "What's wrong with you? What?" And that worked. So here, that's his way of trying to save his parents' marriage by engaging in behavioral and verbal disruptions, so that now the attention can be brought on him. So that's just some things that can happen. They can have unpleasant thoughts. They have very high anxiety about the future, and they will do certain things to actually bring attention to them at this age. For age 7 to 11, they may feel again, there's a struggle with abandonment. That they tend to have what's called separation anxiety, where they're wanting to call their parents or have their parents text them because of feeling that they could come home and no one is there, or that they may have to go to a grandparent's house, and they want their parents. They also too really tend to sometimes act out too, so that they don't understand some of the reasons why their parents would not want to be married anymore. And they can start to think that, well, their parents are divorcing them, so that brings up a whole nother challenge, which a clinician like myself would be able to really start to engage in exercises to help them to feel more secure and have the parents affirm them more often, so it can really start to help them to be more grounded and secure. And then finally, the ages of 12 to 17, which is basically prepubescent to adolescent, they sometimes can blame one parent for the separation and align themselves with the good parent against the bad, which again, that is what's called the triangulation I talked about earlier. They may accuse their parents of being mean, and this is very common, particularly that their parents aren't listening to them. So sometimes they can become very demanding, and they can also be very manipulative. So some kids, they'll take advantage and say, "Well, you're not listening to me that I, want to get this car, or I want to get this PlayStation," and they pit one parent against the other. They may call the parent selfish, engage in verbal and physical aggression with their peers, but they also tend to exhibit more depressive and anxiety-related symptoms. So I know sometimes I'll hear parents, they'll talk about, I think my child may have ADHD, and I often say, well, I probably will have to look more into that, but I doubt that, because look at what's going on now. There's a separation, you're talking about a divorce, and then you're talking about moving. That's going to cause anyone to have impulsivity or inattention and concentration issues. So let's wait. Let's look and assess, and we can go from there. There's also academic decline. So a lot of times, a child who was earning honor roll status each quarter, now they start to decline to C status and D status. So it's very concerning for parents, which can actually now cause more arguments, because now one parent is saying, "Well, it's your fault," and the other parent is saying, "No, it's your fault," and it just becomes more disruptive. This age group too, they have problems now with establishing and maintaining more intimate relationships, because they feel that it could end like their parents. And if there's any indication of fighting, they'll just withdraw. But then also they're more likely to be sexually active because they want that security, they want that closeness, since they saw that their parents, have now departed, and now they have to, see them every other week, or there's, other, arrangements that take place. So unfortunately, some uh, of these adolescents, especially the later adolescents, they drop out of school, they engage in drug usage, and engage in other forms of delinquency. Just as the research says, and I've seen it too in my experiences, because of the divorce. So we can see at the age groups what happens. And I didn't say much that was positive. So it's just a lot to really consume what these parents are going through because of the separation and divorce. All right, so I'll go into the next slide. So these are behaviors affected by mental illness and substance usage. So when we look at a parent and we're trying to identify potential signs of an undiagnosed or diagnosed mental illness, we look at substance usage. So you may have a parent say, yeah, it looks like the other one is engaging in alcohol every day, or when you're interviewing them or talking to them, you'll smell the alcohol or other drugs. I know marijuana is very popular today, so there may be more usage of that. Confused thinking, so they may not remember appointments, and just show up and say that it's your fault. Prolonged depression, so that's something that can happen. Is irritability, sadness, anhedonia. What that means is when a person loses pleasure, there's no interest anymore in activities they once enjoyed. So that can create some challenges, especially when we're looking at custody. Because I remember a case where an individual would, when they were stressed from their child behaving poorly at home, would get some alcohol and then lock themselves in the room, and the child would want to come in and talk to them because they knew what was going on, and they would close it and engage in profanities. So that was a tough case I had to be involved in. Feelings of extreme highs and lows, so almost kind of like a bipolar disorder, but there's highs and lows with divorce. So they think about the past, they think about the future as far as the uncertainty. Many people look at the finances as a big challenge, because you went from 2 salaries now to 1. So there's excessive fears, worries about the future, their child. Sometimes they start to develop health issues, a parent. Feelings of anger, especially towards the other, as we both see as attorneys and clinicians. That anger sometimes again can be turned on to us. Social withdrawal, dramatic change in eating or sleeping. Many of the parents that I talk to, they tend to either overeat or undereat, or engage in excessive sleeping, or not getting much sleep, with just what they're dealing with, especially if it's very disruptive and tumultuous. And here, all right, and I wanted to actually show you too, and then we'll get back into this. But these are some pictures of children that I've talked to throughout the years, not just a few, that actually, as a result of separation, some were dealing with the divorce. I asked them to draw pictures of how they were feeling, what their future looks like. And here's one of them here. So this person wrote, "In the future, I want to be nothing." And he colored. This is a sort of a copy of it, but he has 2 guns, and you can see the face, the angry face, and he's shooting, to the, this expressing his anger, so he said he didn't want to be nothing. So again, kids kind of lose hope when it comes to, just this disruption in their world. So this is a picture here. This was another picture of a child for Valentine's Day. I said, hey, can you sort of write down how you feel? And this person, they actually went through a divorce, the child, and he was living with his grandmom. So I had to interpret this picture, so because it looks kind of like there's suicide here, but what happened in this picture was he drew a picture right here of his grandmom, and you see like a hole there. And what happened when I was able to figure it out, but then I asked him to verify, his grandmom was just diagnosed with cancer. So he was really sad because his parents abandoned him and his grandmom just got diagnosed with cancer. So in his understanding, in his world, he looked at, well, maybe uh, what am I going to do, here if that takes place. So this was a picture that I've kept as far as a child, dealing with, again, this separation and divorce. And then I'll read something really briefly too. This was a child I had write a letter because his dad was so upset that he didn't want to adhere to the custody arrangements. And so I had the son reach out to him, and he was 8 years old. So he wrote, Daddy, I really miss you. You haven't seen me and Keandra. Me and Keandra really want to see you so much. We always want to see you, but you make me sad every time I think about you. You always come into my mind when I'm in class. I really would love to see you sometime. Keandra really wants to see you too. When will you come and see us when you're off work? Or you should come when you have free time and you have nothing to do. Sometimes I call you and you do not answer. These are just a few of many, but just wanted to share with you again what some of these children go through. So looking at mental health a little bit more, there's behavioral, there's genes that take place. So there's a paradigm called the stress diathesis stress hypothesis. So what that means is the genes is a diathesis, and then stress is what can now cause those genes to emerge. So that's something that is a paradigm that I definitely believe, and we all have something. And then if there's enough stress, or like there's a difference between chronic stress and toxic stress, it can now emerge and create some problems as far as mental illness. So there's a risk of mental illness. So it increases if you are using drugs, alcohol, not garnering enough nutrition, lacking a support system. So that's very important, to have a support system of friends, family members. Traumatic births, that can be something that can actually cause some real challenges. High-risk pregnancies. For traumatic birth, there's a term called hypoxia. So hypoxia basically comes from when the child is being born. There's an umbilical cord that's wrapped around your neck, so it cuts off the oxygen, and if it cuts it off enough, and they're unable to cut that cord in enough time, it can cause some brain damage, which can lead into various mental illnesses. Some of these high-risk pregnancies too, you're born earlier, a couple months earlier, you can have challenges too. Cancer, diabetes, normally people who are dealing with cancer may have depression, they have anxiety, some may have, PTSD, depending on what took place. Family history, that's very important, of course, of behavioral health disorders. Any neurological disorders, dementia, Alzheimer's disease, sleep disorders, again, extreme stress, traumatic brain injury. As we know, some of these boxers, football players, when they have traumatic brain injury, things can take place, or have had a traumatic life event or a history of abuse. And abuse, especially sexual abuse, causes some real challenges as time goes on, especially if there's not early intervention that can take place where, PTSD, there's what's called personality disorders, which we'll get into, that can occur from actually sexual abuse, and then someone who struggles with spirituality or beliefs, right? And another part in the literature that's important to recognize is something called adverse childhood experiences. So what happens in that there's negative experiences that take place between the ages of 1 and 17. So they're usually traumatic events, and it can affect actually a person's health throughout their lifetime. So it can lead to physical health, behavioral health impairments, and of course, substance use disorders. And they're higher, the ACEs are significantly higher among parents who have substance abuse disorders compared to those without. Because again, with substance use, it's really, there's a lot of instability that takes place with substance usage, which we'll get into. And children, of course, where substance use disorders are in the house, they're more likely to experience various forms of ACEs, sexual abuse, physical abuse, and emotional neglect. All right. These are just some statistics, there too that would be good for you to note. And then when we get into parental capacities, so in the child custody, the parenting capacity, of course, refers to a parent's ability to meet the emotional, physical, and developmental needs of their child, and of course, assess this to determine which parent is best suited for an environment that's supportive and stable. And this assessment, includes again an examination of both the parent's abilities, behaviors, and circumstances where we have to collaborate together as a team to assess that. And with the emotional availability, it's the ability of a parent to provide that emotional support and proactive response to the child's needs to maintain a strong emotional bond, and of course, comfort and security. So I look at it as, can a parent help the child to feel secure? Can the parent help the child to feel like they're significant, they're a priority? And how is the parent helping the child's self-esteem? So are they screaming, blaming, yelling, shaming the child? That's going to really create some real problems for the child emotionally. Or are they affirming? Are they having one-on-one time with the child? Are they getting the child involved in sports? Are they being able to talk, to them and just ask them how things are going? So that to me is important when it comes to that emotional availability. The physical care and supervision, basic physical needs. So looking at clothing, can you provide that? Shelter, food. Is the child's hygiene? Is it you're on that? Because anyway, at certain ages, kids tend to have poor hygiene. So do you have a parent who's saying, okay, come on, we need to take the shower 7 days a week. You need to eat fruits and vegetables. Is for shelter, or is there inconsistency with housing? With paying the rent or the mortgage? Because if a child hears that, here we go again. Now that the anxiety starts to increase, the depression, the not having that security that's needed for them to function. Ensuring also that the child is kept safe from harm, and that environment is secure and appropriate for their age and developmental stage. So I just recently, actually a couple months ago, I talked to a man who just went through a very tumultuous divorce, and his reason for coming to me was his situation that took place. And what happened was his ex-wife had some challenges with the physical care and supervision, was kind of struggling to pay her rent, and she had to work another job. So she had her friends, various friends, come over and watch their son, which she could have just had the dad watch, but she just didn't want that to take place. But what happened was the dad was noticing there were some changes in his son. So he went into his son's phone, and what he found was his son was being sexually abused. He found that one of the ex-wife's friends experimented with him and was continuing to experiment with them also, and intervention had to take place. But some of what he read to me was extremely graphic and disheartening with what this man was saying to his son. So you always want to make sure that there's the right supervision and also the physical care for the child, because now you think about it, there's double trauma now. You think the trauma from what was happening with the separation and divorce, and then now subsequent trauma because now he was sexually abused. So this child is going to have a really tough time throughout his life based on just this real short duration of a lot of traumatic events. So health and mental well-being. So it's a parent's physical and mental health, plays a critical role in their parenting capacity. So, mental health and substance abuse, does raise concerns about a parent's ability to care for their child. So it's always good to really get a clinician involved, and a psychologist to assess, to be able to see if there's any mental health disorders that could cause impairment in their ability to parent for their child. And then, of course, parental involvement and engagement. That's where a parent should be involved in their child's life. So education, extracurricular activities, emotional development, and also healthcare. So a parent should try to again spend that time, nurture their strengths, affirm them, look at other interests so that it can sort of really get the child to start to move in a different direction, and also supporting their social and intellectual growth. All right, and parents' ability to guide and discipline. So that's important. There's actually 4 schools of parenting styles that I'll talk about just briefly. But the first one is permissive parenting, and that's where parents are just letting their child do whatever they want. There's really no rules. There's neglecting involved. The parent isn't involved much, or they neglect them. Then there's authoritarian parenting, and what that is where a parent is just really kind of like the military. They're just really going overboard in terms of what they say to the child. So there's not a lot of nurturing. It's more actually transactional than relational. And then there's what's the best is authoritative. That's the best, where there's just a balance, so there's rewards, there's consequences, there's nurturing, there's support, there's not blaming and shaming. There's a lot of affirming that takes place in the authoritative. So it's important when you're asking about, again, getting an assessment for parenting, looking at, who is better at that? Do they have effective communication and problem solving skills and a willingness to learn? So I recommend a lot of parents to go to a co-parenting class, or to go and get help from a therapist where they can get parent training to just be better parents, for the child. So cooperation, I'd encourage parents to cooperate with the others, especially in these shared custody situations, trying to maintain a positive relationship, communicating effectively about the child's needs. I know right now, person who's going through divorce, my client, his wife blocked him And I said, I don't know how that's possible. Could you share a child? And he said, yeah, it's really difficult, Dr. Pastor, I know. And I don't think the court's going to look too favorably on her blocking you when you have a shared interest with the child. So willingness to foster the relationship with other parent and trying to avoid conflict. So conflict can be inevitable because it's high stakes there, with what goes on, but really trying to mitigating and doing what's best for the child. Because as we learned earlier, just the disruptions are really not the best when it comes to child development and progression. And then one that I see and hear often is undermining the other parent's authority. So just not really taking into consideration, saying I'm going to be spiteful and cause more challenges. That's not something that is wise when the divorce is starting to occur. And stability and consistency. So again, assessing the stability of each parent's situation, employment, really looking at that stable environment, because we'll go into what inconsistency does. But what I've always said is that when you have consistency, it equates to predictability. And that's what kids need, predictability and stability. So if you can have that, something, again, I recommend having parents to have similar schedules at each other's homes. Now, some parents refuse to do that. They say, well, no, I don't want someone telling me what to do. I said, well, no, it's not about that. It's about the kids, because if they can know that their bedtime is 9 o'clock at both homes, that provides stability. If they're eating the same course, sometimes there'll be deviations because of sports. But if you can really try to cultivate that environment, there can be some really good outcomes for the child. Because I never met any parent that says that they want the worst for their child. Everyone says they want the best. They want their child to be happy, cultivate independence when they're an adult, and successful in whatever they do. So stable environment is really crucial in a child's well-being and development. And then looking at past behavior too. So a history of physical, emotional, sexual abuse and neglect. Domestic violence is now called intimate partner violence. Can really have a significant impact on determining parenting capacity also. So, I know the courts look at, there's any harmful behavior, if the person is constantly angry toward the child, that can have some, poor outcomes and criminal behavior, all that can really cause some challenges there too. So these are some elements there to be considered. And then something that really, when we're looking at some of the disorders that can take place, that can really cause some impaired, parenting, can be trauma. So post-traumatic stress, and then there's something called complex post-traumatic stress, which it means multiple traumatic experiences, and they coexist with anxiety, depression, substance abuse disorders, personality disorders, and particularly, and I'll go over that today, borderline personality disorder and antisocial personality disorder too. So different types of traumatic events. When we're looking at trauma, there can be natural disasters, domestic violence, shootings, bullying, car accidents, sexual abuse, of course, war-torn area, witnessing the death of a person, serious injuries, loss of a family member, and then, of course, parental divorce or separation. So that can be traumatic. So as they're going through the divorce, it can be traumatic, or again, I think it's double if there's complex, or if they were sexually abused when they were young or raped when they were in college and didn't resolve that. Some of what can happen during the court process and even prior to that, a lot of this unresolved trauma can come out, and it can get really, really nasty, which the attorneys, of course, are involved in that, and my professional group is involved in that too. It's just dealing with the from the text and phone calls, and that can be really challenging when you have someone like that. So it's important to know what to do, and I'm sure you have questions as far as what to do when that does take place, where they're trying to get you involved in some things, but you have to look at it's not just the divorce. There's some underlying psychological underpinnings that's taking place where they're projecting it or displacing it on the attorney or the clinician. All right, and then for this here, these are I'm going to go a little bit over that. And these are called personality disorders, and these disorders, in my experiences, when it comes to collaboration with the other parents, uh, can be very, very difficult. Or even a parent who has this type of challenge here, because a personality disorder means that it's part of your personality. So with the anxiety, depression, PTSD, with treatment, you can actually see some very good outcomes. With personality disorders, these are very chronic, and it can be very, very difficult to treat. And they also normally have a coexisting disorder like anxiety, depression, PTSD, substance usage, that can make it even more difficult. So the first one, and these are a cluster where they're defined as more emotional, dramatic, or unpredictable. So you can see how that can be very difficult when it comes to parenting if someone is overly emotional, overly dramatic, and very unpredictable. Because as we learned, unpredictability with kids, it's going to be very difficult. This dramatic, that's going to be difficult because then they're arguing with the other parent, and then the overly emotional too. So the first one is what's called antisocial personality disorder. So this is where a person has a disregard for the rights of others and begins in adolescence. So the precursor to that is a disorder called, and I put it in, conduct disorder. Normally, if that's not treated, it can lead to this antisocial. So these are people who normally engage in behaviors that can be more criminal. So they're very aggressive towards their spouse, verbally, physically, and also the children too. So they may be the ones where Child Protective Services is involved. They'll take a lamp and hit their spouse, or a bat and chase their kids around and hit them. They don't have a regard for rights, and they can be manipulative, exploitative. So if someone were to interview them, and you think they're the nicest person, but behind closed doors, they can really be very, very problematic. Borderline personality. I'm sure you'll hear people that your clients talk about, well, I think my spouse is borderline. Well, the definition is it's a pervasive pattern of instability of interpersonal relationships. So they have instability, identity issues, impulsivity, and they have a real intolerance of being alone. And they have, not only an overly positive and negative image of themselves, but also with others. So they'll either love you or they'll hate you. You're the best attorney or you're the worst attorney that you'll ever have, and they'll ever have. And then also there's a fear of abandonment. So that's very important to know too. They don't like to feel, so it's perceived abandonment that they have very unstable relationships, too, and they feel there's a feeling of emptiness that they have, and their identity is really just, it vacillates. Okay. Yep. All right. And then the next two is the histrionic, and that is sort of excessive as far as emotionality, attention seeking. It's about 1% of attention. And then the last one is narcissistic. So they tend to have be grandiose and need for admiration, and want they have a lack of empathy. and they're preoccupied with their achievements and abilities. All right, so I'll stop here for questions. And Nancy?
There is one question here that says from one of our participants, can you review the differences between custody evaluation and mental health evaluation in custody cases, which are reported to the court? If you would like to answer that now, or if you're going to get into that later, we can entertain this question after the break. I'll leave that up to you, Dr. Pasley.
Okay. What do you want to do the break now, and I'll come back?
Yes, let's
Yep.
do that, and
All
then
right.
we'll take that question.
Okay,
All
great.
right, 5 minutes. It is now 1 o'clock. We'll be resume at 5 after 1.
Okay.
Thank you.
Yep.
All right, let's resume our discussion. Thank you, Dr. Pasley.
Yes. You can see me? All right. So the question was the differences between a custody evaluation and a mental health evaluation. So a psychological evaluation is when there's one parent where what I would do is look at their mental health
Dr.
function.
Pasley, are you there?
Yes. You see me? Nancy? 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 Okay. Yep, I'm here.
Dr. Pasley?
Yes, I'm here. I think
Are
they
you
can hear
there?
me.
Can you hear me?
Yes.
We're unable to hear you.
I think it says we can see you and hear you. Nancy? And, I'll continue. Nancy, looks like you're muted. All right, so I'll continue. So a psychological evaluation is when, I would evaluate a parent and look at their mental health functioning to see if they meet the criteria for the diagnosis of any sort of psychological disorders and how it would impact their functioning. So basically, it may not, I would include like a testing, so it'd be a diagnostic interview, psychological testing of the parent, and then also looking at collateral contacts. So basically, looking at records and being able to make an assessment of that. And that's the psychological. So it's more sort of individual there, seeing if there's any challenges, impairments that would cause any issues with the child. And for a custody evaluation, that would include a diagnostic interview, but this is with both parents and all children involved, and having a parenting interview with both parents. So there'll be psychological testing of the parents and children, and there's parent-child observations, and also, again, a records review and collateral contacts. So my job would be to look at the functioning of all the family members and the parenting skills of both parents. So that would be the difference there. And also looking at the kids' needs. So those are the differences. So good question between custody evaluations and psychological. So the psychological is individual versus the custody evaluation. All right. Any other questions?
Not at this time that I can
Okay.
see. Thank you, Dr. Pastor.
Okay, no problem. All right, and so when we look at the instability on child custody, so it's of course, very common. There by fourth grade, 1/3 of children will experience a change in their parents' relationship. Changes in child care providers, schools are common. 12% of all Americans change residences in a given year. So instability is common, but then instability can create a lot of challenges, as we'll discuss. So inconsistency in family environments can really affect the emotional well-being. I just wanted to go through those. And one of the emotional and psychological effects, so anxiety and uncertainty. So as we know, if children thrive on stability and predictability, then inconsistency can lead to anxiety and not know what to expect. Attachment, this can hinder the development of a secure attachment between the parent and the child may struggle with trust and difficulty forming healthy relationships. So when I talk to and counsel many adults, many times I'll trace it back to childhood when they had to go through a divorce, and they now can see that because of what it experienced was they have had from that point trust issues in forming these healthy relationships. The self-esteem, that's very important. So praise shouldn't be sporadic, when it comes to parents, or criticism being harsh, because it can lead to, a negative self-image for the child. So the outcomes aren't very, very positive. And then for the behavioral outcomes, we look at, behavioral issues such as defiance, aggression. There's a term called relational aggression, which is called bullying. So a lot of times what happens with kids when they experience trauma, they want to control, which is bullying. They tend to have trust issues, self-esteem issues, intimacy issues, and safety and security issues, also. Boundaries, they tend to, violate. A lot of times what happens with parenting, especially when there's separation, divorce, one parent may want to be the Disney parent, so there's not a lot of clear rules and expectations. So they tend to have, without boundaries, poor interactions with peers and authority figures. So we've seen so far what inconsistency can do in terms of the development of some real challenges for the kids. And cognitive development, inconsistent home life can cause problems with focusing and learning, which does again impact academic performance, and ineffective coping strategies and problem solving skills too, which is so important as children develop. And one of the things too, when kids come from inconsistent homes, as a result, they tend to, as adults, have relationship issues where there's intimacy challenges, trust, communication in their relationships. Also, too, adult psychopathology can take place where there's anxiety, depression, PTSD, and some others. And something too that I wanted to include is intergenerational patterns. So there's a term in the literature called intergenerational transmission. And that basically, when you grow up in an inconsistent environment, can perpetuate instability in future generations. So the way they observe, even though they may say, I don't want to be a part of that because of the intergenerational trauma, it can lead to where they actually unconsciously do it when they're in their own families in the future. All right. So when we look at, just being able to take some steps to ensure that there's effective representation and support, as you all are doing today, you're educating yourselves in terms of these behavioral health issues, and you got some of these common disorders that you see, and also what are the effects, the deleterious effects on uh, the behaviors and the decision making. So it's important to know some of the laws too, the ADA and some of these others when we're looking at dealing with custody and the parents. Being able to open up the lines of communication is very important. So as attorneys, as I do, listening actively and sensitively to the clients and not judging them, because again, just like with my field, judgment can impair interactions. It can also impair it for your field as far as attorneys. So just giving them time to express their concerns, feelings. I mean, they're going to talk about their spouse. You're going to talk about finances. And you're going to talk about a number of different stressors, but just really to being empathic and understanding and saying, I know this is difficult, but we're going to be able to do our best, to get through this situation. I know it's very, very difficult. And then also too, in a situation where you are finding out that a person has some of these behavioral health challenges, maybe cognitive, advocating for them as far as some of these court schedules, support individuals and alternative communication methods. So really being an advocate and then considering their competency. So for some of these disorders, it can really be challenging, especially if they have coexisting, uh, cognitive disorder. It can be it can be difficult for them in terms of understanding certain legal proceedings and decisions. So just kind of talking to them in a simplistic way, your client, to help them to understand that this is something that could happen, and also too, assessing their competency to see if they're able, in terms of guardianship and other things. And then something that's huge is a support. So just being able, when you're looking at resources, sort of having a list of different resources that you can use. So knowing various psychologists, social workers, psychiatrists, and then being able to say it in a way that won't be offensive. So what you can say is, you know what, I feel what you described, you're going through a lot of stress. I wonder if it would be beneficial for you to maybe look into psychotherapy. What are your thoughts? And they may say, what are you saying, that I'm crazy? No, actually, I'm not. I'm just saying that because of what I'm hearing, it seems like you're going through a lot as far as the job stress, the divorce, your kids are acting out, you have some, a recent death. Why not, consider that? And I know a few clinicians that may be a benefit that you could utilize, for your individual counseling, and I'm hoping that you could consider even maybe a co-parenting coach, as time goes on, because if we look at, you describe how difficult it is with rearing your child, that may be a benefit. What do you think? And even knowing some child therapists too, to say, maybe your child would benefit too, because it seems like there's just a lot of challenges that everyone is facing. So to me, that's again going back to advocating and helping them connect with these resources. And then there's support groups too. There's NAMI and AMI, that's and National Association of Mental Illness, where they get their support groups there. There's Al-Anon when you're looking at substance abuse, AA. So just really being able, to advocate and say, I wonder, maybe, so you said you didn't want to go to counseling. You ever thought about a support group? I know there's divorce groups that are around the area. I know that there's groups that tailored to mental health or to children. So if you say you didn't want to go to counseling now because you don't have the money, well, you can actually go to a support group, and it's actually conducted via Zoom. That could be really helpful, for you. Different advocacy organizations too that can help them, and like I really admire this organization that you're helping others that are going through this conflict, that reduce the minimal price there to help them through this very arduous time. And then that collaboration, so working again with the behavioral health professionals to sort of look at getting their insights into the particular client's mental state, their needs, and looking at what would be beneficial. So there's best interest attorneys, there's attorneys on both sides, and working as far as with the professional in what they see and what they would recommend, since they're actually seeing the client very often, so that things can really work out with the case. As we know, we discussed today, things are so disruptive, so to help and collaborate, and then having a better outcome for our clients will really be beneficial for them as they go into the future.
Dr. Passley,
Yes.
we do have a question.
Yes.
Can we discuss the competency problem a little more thoroughly? I don't see a way to indicate that my client is incompetent in a child custody case.
Okay. So what you have to look at is the impairment, as far as looking if there's a clinician involved, being able to talk to them. And as I mentioned earlier about the psychological evaluation or custody, being able if you're seeing substance uses, if you're hearing about any violence, if there's a lot of manipulation. Sometimes you see texts that are very offensive or blaming. Being able to look and say, well, would this be in the best interest for a child to be in a situation where this could happen? And I think having that clinician, because again, it's tougher to just look at it and say, well, I believe this person, but I can't prove it. But having the clinician be able, to write a letter based on what they have seen, or you have the psychological testing, that doesn't lie. So it's going to show what the diagnostic information is. In addition, to if there's CPS reports, if there's, the inconsistency with school attendance, and all those impairments would cause one and a judge to say, what, for now, this person should have more in terms of custody than this other, because there's more stability here than the other person. Does that answer your question?
You can go ahead, Dr.
Okay.
Passley.
All right. And so tailoring legal strategies. So again, understanding the mental health, that's important. And then really being able to advocate for the rights and challenging stigmas, protecting, the rights, and those ethical considerations, of course, maintaining confidentiality regarding, the behavioral health and, competency, as we discussed, and that's where mental health professionals come in, because you're not trained in that, but the clinician is, where they can actually assess and show you the documentation that this is the impairment that's taking place. Like again, if there's a borderline client, and this person is out all the time, where there's a lot of rage that's going on in the house, and there's evidence where there's a child that's bruised or is that emotional abuse, that is where you can be able to advocate more for, the child.
Dr. Pesley, the
Yes.
previous participant did respond and to your, if it answered her question appropriately. And she says, I think it goes more into an ethical section. I can't disclose my client's mental health issues, etc.
Okay. So as far as, well, I would say that, but if they have mental health issues, then that means that's just someone who would have a clinician. If they have a,
Rebecca, she hasn't responded yet.
okay.
You can move
Yeah.
forward and then we'll go back to
Okay,
that.
yes, yeah, that's good question. All right. And then these are some references here that I have if you ever wanted to look at them. But as far as the competency, there normally is a mental health professional. If they're disclosing, what you would say is, can I, again with the informed consent, be able to talk to your clinician so we can get some more information in regards to this case. Let's see that response.
Here is the response, Dr. Pasley.
Yes.
If a mental health issue causes my client's competency to be in question, I'm not sure how to bring that to the court's attention ethically, and it certainly impacts my client's case, often in a negative manner.
Okay. All right. Now the competency as far as all right, with the mental health, there because it's to me that it'd be important because if they're telling you you can't disclose, I would, in my opinion, what I would have to do or would recommend is to be able to get a clinician involved. Because what you would say in that situation is that, I think with what you've described, it would be very challenging in terms of raising a child because, as we know, things are very stressful. So, to do my job better, I would like if you could be able to give me the permission to contact your clinician. So that would be ethical. Yep, you're welcome. Yeah, that's what you do. Because normally, if there's mental health, there's normally a clinician there, or even a past clinician. So you would just say, what I always say is, I talk about the kids. I say, well, if we're on the same page as the outcome for your kids, do you think it would be advantageous or beneficial if I could be able to talk and collaborate with this other person? But remember too, I'm glad you asked, Rebecca, because what happens is a lot of times they're going through trauma, and as I mentioned early, trust is impaired at that time. So I've heard many people say, I don't trust my attorney, or I don't trust this, and so that time, what you want to do is build that security and trust that, hey, this is only for for good outcome here for the case. And I don't know too many people who say, well, no, I don't want to do it still. They'll say, well, yeah, because you're representing me. Yes, I want the best outcome for the case. So great question. All right. Any other questions as far as yep, welcome. Just with the parenting capacity, the custody, my role as a clinician.
We have another question here in the chat. Dr. Pasley, what types of personality traits or mental health issues would a psychological evaluation uncover that a standard custody evaluation might not?
Well, he goes very deep. Yeah, there's different personality. There's something called the MMPI that goes and digs into personality traits, anxiousness, depressive nature, instability. So what we do is we get deeper and use a battery of tests, so it will be able to show us what this person actually is going through in terms of those personality traits. So we can see if we get a hunch, we will use another assessment, to be able to say, okay, it sounds like this, maybe this, so let's go and do this, so we can see that they have a strong, it's a strong component of this particular personality trait or disorder. So that's what we do in a psychological evaluation versus just custody. It goes a little bit deeper because we're assessing the one person instead of custody evaluation, which is everyone. So we're getting interviews, records, we're doing assessments, we're doing a diagnostic evaluation, also, which is pretty comprehensive. But then the battery of psychological tests will corroborate, the speculation from the assessment. And then that helps you as the attorney to actually say, well, this is comprehensive here. This is what we have. And then that whole custody, we start getting into that parenting capacity to say, okay, well, with what we have here, will this person be able to parent this child in a way that's going to lead to a very positive outcome?
Does that answer your question, Sharice?
No.
Thanks.
Yep. Very well. Yeah, great questions. Great question.
Good question.
Yes. Yeah. So that's why it's so important as attorneys that we work hand in hand. So again, we need each other when it comes to this, because it can get really, really difficult. So we all work together and we use our expertise, to be able to have good outcomes for the clients. So great question. Yeah, great question. So it's good. So again, this is just the beginning as far as the genesis of some of these disorders, but yeah, just learn like a few. You don't need to know much, but just know some that you're seeing that's kind of common. Again, anxiety and depression, but now the profound anxiety and depression can cause impairment. But some people try to use that apparent. Well, they have this, and that's why they can't do this. But most parents who have anxiety and depression can still parent. But when you now add substance abuse and other drugs, then that's where impairment can take place, because now that will exacerbate, the anxiety and depression from the drugs and the alcohol, and then they're not able to parent the kids in a great capacity. Because again, if they're drunk or they're sleeping and the child says, "Hey, I need help," they can't help them. Which can again create some more problems for the child. So we always want to make sure, and there's substance abuse evaluations too. So if you're suspecting something, ask the clinician if they can conduct that too, because there's various assessments there that you can use. So it's just kind of looking at the whole picture, to have the most evidence to say that, okay, well, this is why we're going to suggest this to the court for the judge to consider.
Thank you, Dr. Passley. Are there any other questions that are any of you have at this time? Dr. Passley, would you put up your contact information? I think it's probably in the next slide or so. There it is. There you go. This was a very, very, for me and for all of us, it was a very comprehensive and educational program, and it's helped us so much in understanding a little bit more about our clients that we see. In the Judicare program particularly, and in our practices, the majority of I don't know if it's the majority, it depends on the type of cases you're representing. But certainly when we're faced with a contested divorce or custody hearing, particularly the custody hearings, these types of issues seem to be rampant.
Yes, yes.
When there are children involved. In my career, I don't think I've had many custody cases where there hasn't been some form of alienation, practices going on, maybe not necessarily in the realm of a diagnosis of mental health diagnosis, but certainly in some of the other areas that you've described, people being depressed, or the fear of the unknown, or not the apprehensiveness of everything that is going on in their lives, and particularly how it affects their family. So I know that this was very helpful for all of us, knowing, getting a better understanding of the kinds of things that you see and your role in our work as we go through these issues. I do want to mention to all of you that, and I usually mention this early on, and I did put it in the chat, the PowerPoints will be made available to you, as well as the video. I will be sending all this information out to all of the participants in a couple of days. It takes a couple of days to get these uploaded. So we will do that, and I will make sure all of you have a copy for your further review and for your libraries, your family law libraries. Dr. Passley, I must say this was, again, wonderful. I thank you so much for coming to us and agreeing to do this presentation. I will suggest that if any of you, after the fact, have some questions about the program, or any specific questions in what was presented to you, Dr. Passley, I don't want to blow your phone up or your email. So, but you can email me, and I will make sure Dr. Passley gets the message.
Yes.
If that works for everyone on the call. I think that would probably be the best way to handle this. And I'm looking, I thought there was maybe another question, but there is not at this point. So without further ado, if anyone else, since there are no further questions, I will conclude this program. Dr. Passley, you and I shall talk in the next couple of days. I do have a couple of things I want to go over with you regarding some of the information you gave us as to references.
Yes.
And I may consult you about that in the next couple of days. So thank you, all of you, for attending. I hope you enjoyed this program as much as I did, and I want you all to have a wonderful week. And, given the, some of the anxiety we've experienced perhaps this week, all I want to say to all of you is, let's all extend a hand to one another and reach out and touch someone, and know that we're all here for each other, and we're here to help. So thank you so much for your participation and to be a part of our Judicare program. Have a wonderful weekend.
Yes. A wonderful weekend. Thank you.
Bye-bye now.
Yeah, bye-bye.